bukan untuk tenangkan diri lah.
So meaning to say that in anxiety there may be symptoms like physical symptoms. However, in fear it's just an emotional state. So kalau dalam bahasa Melayu mungkin kita akan cakap rasa takut kan.
Puan ada rasa takut ke? Encik ada rasa takut ke? Tetapi rasa takut tu tak semestinya ada symptom macam jantung berdebar-debar macam tu kot.
Okay. Alright. So does anyone else agree? Haseh, what do you think?
Yes, I agree.
Okay. Okay. So what about in terms of worry as compared to fear or anxiety? Afaf, what do you think?
Okay. I think worry is like patient is state of mental distress, agitation, like worry about that the patient can have the episodes again, and that fear is something like in the moment in response to a stimulus, but worry is something maybe patient can worry about something that can occur in the future, like that. Macam risau Malay. And the word for anxiety maybe resah.
Resah.
Something that I read, worry is a condition where the patient keep thinking for a problem solving mechanism regarding some event or some event lah. Maksudnya when we say worry ni, I think it's a condition where the patient dia akan macam keep thinking macam mana nak selesaikan this problem. Berbeza dengan takut, kita takut dengan hantu, tapi kita tak fikir macam mana nak lawan hantu tu. In a worry, kita macam mana aku nak ni, macam mana, it's more to a problem solving punya mechanism of thinking lah, macam mana dia nak. Usually it's related to problem yang dia nak try solve kan. Okay tak? Macam faham tak?
Faham. Kalau takut tu dia tak ada pun
kan? Macam kita takut dengan anjing, kita akan takut je lah. Tapi bila kita nak turun bawah, kita risau ada anjing, kita worry about anjing, kita akan try untuk macam mana nak evading the anjing.
Faham.
So doctor asked to add another term, which is panic. So panic would be an acute intense attack of anxiety accompanied by feelings of impending doom. So it can be characterized by discrete periods of intense fear. So macam it can vary lah. Have several attacks within a day or within a year. Discrete periods of intense fear. So it's like the spectrum anxiety is the worst. Is the panic tu bila dia sangat anxious lah. I think anxious tu is like a state of anxiety.
Betul. It's like a state of anxiety.
Kalau ada orang lain ada definition yang lagi cantik, boleh bagi. Trauma.
So phobia pula similar to fear. So phobia is excessive. So dia rasa takut yang sangat berlebihan. Dia ada definition dia whereby it may impair the function of a person, and then kalau ikut DSM pula ada like for a period of duration lah, maksudnya a duration of 6 months or so. So basically it's excessive. So kalau trauma, has anyone found the definition of trauma?
Dekat, okay, sorry. Uh,
Trauma and
So, what the Uzai had shared to us, trauma is any disturbing experience that results in significant fear, helplessness, dissociation, confusion that have a long-lasting negative effect on a person's attitude, behavior, or other aspect of functioning. So, usually what I understand, trauma is preceded by something event that is distressing the patient, and patients start to have overwhelming amount of stress than the ability compared to the ability of patient to cope with the problem. Something like kalau contoh for example paling common if patient had MVA before, they tend to remember that incident and they feel like kind of trauma.
Daya, can you repeat the definition kejap?
Dekat chat ni, any disturbing experience.
Okay. So kalau dalam bahasa Melayu, how do you ask about trauma? And what do you think is the difference with fear?
Boleh tanya macam waktu kecil tu ada tak pernah mengalami sesuatu yang nak cakap
Saya rasa trauma ni macam satu benda yang macam memang dia experience sendiri benda tu. Macam benda tu sangat distressing, lepas tu dia macam experience benda tu. Macam contohnya MVA ke, kan, serious injury ke, sexual assault ke. Maksudnya dia rasa sendiri benda tu, dia macam experience.
and that akan affecting kehidupan dia lah. Kalau macam takut je, ya dia takut, tapi trauma, because dekat tu dia ada have long lasting negative effect. Maksudnya contoh macam dia pernah kena rogol ke, so to say that it's a traumatic event if the rogol tu itself, the event tu ada some long lasting negative effect lah. Contohnya patient dia takut nak berkahwin ke lepas tu, dia takut nampak lelaki ke, dia takut dengan ayahnya.
Okay.
They might repress the trauma lah. They try to forget the incident and you can tell from the defense mechanism that incident is actually a traumatic one.
Okay. So basically kita setuju yang trauma ni memang kena ada event dulu yang dia pernah experience sendiri. Betul kan?
Tapi kan kalau tengok dalam PTSD
ya.
DSM-5 ni, dia punya trauma tu tak semestinya dia experience. Dia boleh macam witness ataupun the traumatic event.
Okay. So any disturbing experience. Okay, faham? Okay, so boleh move on ke?
Boleh.
Okay. So untuk obsession pula, Okay, so kita dah ada dia punya definition. Okay, Hidayah mungkin boleh huraikan semula secara simple.
So obsession ni is a mental event in which is the thought, patient thought, feeling, idea or sensation which coming recurring and persistent, and it is includes patient life, yang mana it cause stress to the patient lah. Because it keeps coming in persistent to the patient mind. So basically kalau we want to ask patient, biasanya kita kata ada perasaan was-was tak? Ataupun sesuatu yang mengganggu fikiran yang sentiasa ada and kuat berulang. Any other people want to add? So this obsession ni it can cause anxiety of the patient. Patient will feel distress and patient need to relieve the anxiety. Biasanya it will perform compassion lah. So compassion is a behavior, it's a conscious, standardized and repetitive behavior of ritual routine.
Assalamualaikum.
Waalaikumsalam.
Okay,
Okay.
thank you. Thank you for the discussion. I've been listening to your discussion, and so you have some ideas about it, but I need to do some kind of clarification, refining of the definitions that you discuss. Secara umumnya apa, Salma, if I can speak in Malay, if you don't understand, just tell us what are the common terms in Malay that we use to discuss or we use to express ourselves as far as anxiety is concerned. Apakah perkataan-perkataan dalam bahasa Melayu yang selalu kita gunakan? What are the common terms in Malay?
Takut.
Risau.
Okay, so you have risau, you have resah, you have takut. Lagi? Modern people they use phobia, they even use phobia, isn't it? Right? And trauma. But people often have their own definition of what trauma is and what phobia is. And then I heard someone say about was, okay, to indicate it is an obsession. Okay. How about compulsion? Is there any equivalent word in Malay? Compulsive behavior. Okay, there is none maybe. How about anxiety itself? What is anxiety in Malay?
Keresahan, doktor.
Keresahan, resah, risah gelisah. Itulah dia, in Malay there is no equivalent to anxiety. Actually, there is no equivalent term for anxiety, and thus they use anxiety in Malay juga. ANZIETI, anxiety. So they just use the English words into Malay because there is no equivalent terms to anxiety. When we talk about anxiety, we need to differentiate between normal experience of anxiety and the pathological one. And this is applicable to any psychological experience. Sadness, worries. The other symptoms that you learn in psychiatry, it can be normal, it can be abnormal. So what is the principle to say that something is abnormal? So far you have been here for 4 weeks. What to indicate that this is actually abnormal? What are the principles?
The feeling of the anxiety is out of proportion to the stimulus.
Okay, out of proportion, right? Out of proportion following the stimulus. Okay, so that is one. What else?
It will impact the function
Okay.
of normal function of the.
Affecting the person's function. Lagi?
It's persistent and prolonged.
Come again? Come again?
It's usually persistent and prolonged duration.
So it is persistent to the extent of affecting one's function. Okay. So what you mentioned is just an extension of what Afifa mentioned. Thank you. Lagi? Perhaps it cannot be explained by patient's background, social and religious and cultural background. Right? So the key terms here is excessive. It is excessive to the extent that the patient cannot function. And that excessiveness too cannot be explained from patient's background, social and cultural background. So that's a common principle that is shared with other psychiatric diagnosis juga. So we have now anxiety, fear, trauma, obsession, compulsion, panic. Anxiety is the umbrella term for all this. It covers all these terminologies. So when you talk about anxiety, it can be panic, it can be trauma, it can be obsession, compulsion, or fear. So you need to be specific when you ask question lah. Okay. So let's go to the easiest one. I like to start off with phobia. Apakah 4 cardinal features of phobia? Apakah 4 ciri-ciri phobia? It can be easily found in your DSM if you read.
Sorry, ciri-ciri. Is it like marked fear and anxiety about the specific stimulus? And then second is the stimulus always provokes the fear or anxiety, and then the patient will avoid that situation which provokes the anxiety or fear.
Okay.
Is it?
Thank you. Thank you. So the first one you mentioned tadi apa, sorry?
Marked fear or anxiety about the specific stimulus.
Or fear, anxiety. Okay. So you need to put something there. It is an excessive fear of something or a situation or someone. So that is the first features of phobia. Perasaan takut yang amat sangat tentang sesuatu benda, sesuatu perkara ataupun satu keadaan. Okay. So, bila orang takut sangat-sangat tentang sesuatu, apa akan jadi?
Avoidance.
Before you avoid, what does the patient develop?
Fear.
Yeah, fear and other anxiety symptoms, fear and perhaps panic symptoms there. Okay, so patient becomes so anxious when it is confronted with it. Okay, what is another features of that fear? in phobia? Faris. Oh Faris.
Ya, Doktor.
Takut harimau tak?
Takut.
Takut. Mati?
Takut juga tu.
Right. So does it make you does that make you have phobia to mati and harimau?
I think it is not.
Kenapa?
Because one, it does not affect my function.
Okay.
Number two, because it is not out of proportion from the stimulus.
Okay. So the second one is, first one, the anxiety, the fear is excessive. It is, you can say macam, second one is irrational. The fear is irrational. Excessive, irrational, or out of proportion. Out of proportion. Meaning, contohnya macam mana? Afaf? Senang ada nama dekat gambar ni.
Contohnya, if you're scared of heights kan, so it's normal lah if you're everybody on top of a very high building, they'll be scared. But maybe if it's only on level 1, level 2, patient is still scared. So it's not out of proportion to the.
Okay, how to make it excessive? The fear is excessive.
Patient will avoid going to high places, for example.
Okay, I would say something like this. Listening or hear someone talk about it would make you feel fearful. So macam orang bercakap tentang harimau, nampak gambar harimau menyebabkan you jadi takut. So that is excessive. It is out of proportion. Okay, belum lagi berjumpa tetapi baru bercakap tentang benda tu dah menjadikan takut. So that is make it excessive. And the third criteria is you try to avoid the situation. Right? Try to avoid the situation. And when confronted, you become anxious. So those are some of the features of phobia. So what are the types of phobia that you know?
So there's the agoraphobia, the social phobia or social anxiety, and
Okay,
also
you have social phobia, you have agoraphobia, and other specific phobias. Yeah. So how to differentiate between let me think. How to differentiate between social phobia and agoraphobia? In agoraphobia, what is the fear most situation or thing there? In agoraphobia,
it is the inability to get help or escape from that situation.
okay. So the patient is afraid that he may not get help. Okay. Tapi apa yang dirisaukan? To be in that situation, what is so apa yang menakutkan berada dalam situasi tu?
That the patient is not safe and afraid of public places.
Right. So the patient afraid of public places because he or she believes that he won't get any help in that kind of situation. So it can be in public places, it can be in public transport, in closed confined space, or even in open space. The places that you see in DSM-5 are just examples, just to say that those are the places in which the patient are not familiar with. Okay, so the gist is places where the patient has not been exposed to, or places where the patient is not familiar with, thus patient cannot find help, or there is no escape to it. Patient cannot escape because it beyond of patient's control kan. Being in public transport, I cannot just go out. You know, these people are all foreign people. I may not get help here. So what kind of situation, what kind of worry that the patient has? Now we talk about worry. Now, in phobia, we have worry also. So the patient worry that if, let's say, I were to develop panic attack, I may not get help. Or sometimes, if patient doesn't have any panic attack, but they have agoraphobia also. So in that case, they afraid that if something embarrassing happen in that situation, there is no help. So it either in the context of panic attack in public places or something embarrassing which we do not know what. Contohnya, one of my patient do not want to go out from her home because of this fear that she might pass motion in public because she has some neurological problem. Okay, so that is to differentiate between this and that. So that is agoraphobia. So can agoraphobia occur dalam rumah? Can it happen in someone's home?
Cannot.
What is the gist just now? I tell you.
In the place where the patient feels the place is unfamiliar.
Unfamiliar. So if that house is not him or hers, so it can still happen. Okay, that's why I say in DSM those are just examples of places and situation. The gist is patient feel unfamiliar, help is not accessible to him or her. Thus, patient will avoid, or if patient has to, so patient has to go out with someone or has to confront it with intense anxiety. The 4 cardinal features of phobia that I mentioned just now. So that is agoraphobia. Whereas the counterpart of agoraphobia is, the close comparison of agoraphobia is social phobia. So remember, you have to differentiate between these two. Selalunya student confused between these two. Social phobia, what is the gist? What is the core? What is the fear?
Fear of meeting a large group of people.
Not necessarily large group of people.
Fear of getting judged.
Okay. So, fear to be in situation where you are open to scrutiny. Where people have knowledge about you. Where people have access to assess you. Okay? Singing, public speaking, presenting. Contohnya tadi kan, waktu I duduk dalam Google Meet ni, I macam mute, betul tutup screen. I was listening to you guys punya discussion. So let's say the person has social phobia, so she would develop anxiety at that time because someone is observing her. Contoh. Okay? I'm not referring to anyone, contoh ya. So that is social phobia. Provided that the fear is excessive, develop anxiety if exposed, and the patient would avoid. So she would just stop the discussion ataupun avoid from coming to classes, etc. Can panic attack occur in phobia? I already answered this. It can occur when they are confronted with the feared object or subject. So panic attack can occur in any context. It can occur in the context of agoraphobia, it can occur in the context of social phobia, it can occur during obsession and compulsion, it can occur during GAD. Thus, panic attack is not a diagnosis. Panic disorder is. Panic disorder is a diagnosis. Panic attack is just a specifier. clear? Okay, cuba tanya soalan dalam bahasa Melayu. Saya ni pesakit.
Nak tanya macam adakah Cik ada rasa takut yang berlebihan tentang sesuatu situasi?
Right, okay. Takut yang berlebihan tentang sesuatu ataupun situasi kan. I rasa it's not fair to you lah kan, sebab I terus tanya soalan apa nak tanya kan. Dia macam kena start with something jugalah kan, right? I rasa kita buat kemudian lah kot yang kelaki ni. Nanti jadi confused. Dia kena depan-depan kalau nak buat clinical kan, right? So later we're gonna practice on that. Thank you Afifah Sufian kerana mencuba. Right. So let's move to another domain of disorder. That is panic. So how do you define panic? Or what are the features of panic? So panic is an intense state. It's a state where the patient has intense anxiety. Okay, due to some reason. It is a state where patient has intense anxiety, which usually are the short-lived sahaja. It's short-lived. So in panic attack, you can divide symptoms into physical symptoms as well as cognitive symptoms. Can you guys give me the physical symptoms of panic?
Palpitation, sweating,
Go on.
trembling, sensation of shortness of breath.
Right, go on.
Dizziness.
Abdominal pain.
Abdominal pain lagi.
Nausea.
Feeling of choking.
Nausea. Right. Giddiness. Fainting. Pre-syncope. All semua ni symptoms sympathetic symptoms. Your fight and flight symptoms. Kan? Because it indicates that you are in trouble. That trouble is in front of you. That you're going to face something which may be harmful. Okay? Consciously or unconsciously. Sama ada you sedar ataupun you tak sedar. Kalau you sedar, yang you pergi ke exam esok tetapi you tak baca buku kan? So you dapat panic, that is conscious lah. Kan? Kalau you unconscious of it, so itu yang boleh menjurus ke arah panic disorder. So sometimes panic disorder, it is unconscious, it is unexpected. Okay. Before we go there, what is the cognitive symptoms of panic?
Derealization and depersonalization.
That is still physical symptoms.
Fear of losing control, fear of dying.
And fear of dying. So I develop palpitation, shortness of breath, lump in the throat. What do you call this? Lump in the throat? Surgery? Huh?
Choking ada. Dysphagia.
Choking, selain daripada choking?
Dysphagia ada.
Dysphagia. Globus sensation. Okay, globus.
Globus.
Globus. Globus medicus. Globus sensation. Rasa something in the throat. Something. Rasa apa? Lekat. In Malay, what do you call that? Rasa can't remember the word. But anyway, it's here. So shortness of breath, tremors, so giddiness, palpitation, butterfly in stomach, you rasa macam nak kena pass motion, pass urine, and etc. And your brain, your mind interpret it as, am I going to die? So the patient jadi takut, nak mati. Am I going to die now? Am I going to pass out? Am I going to lose control? So those are the cognitive symptoms which worsen the condition. When you think negatively about something, so your brain diberi signal that this is, you are in trouble. So they're going to release more adrenaline and more epinephrine so that you develop panic again and again. So it's a vicious cycle. And those cognitive symptoms are the target for cognitive therapy, cognitive behavioral therapy. Okay. So, tadi ada cakap kat you, macam mana nak differentiate. Ada sebut sikit pasal panic disorder and panic attack. So, how to differentiate between these two? This is panic attack and this is panic disorder. Aja, how to differentiate panic disorder and panic attack?
Kalau patients have panic disorder, then patient has a recurrent panic attack.
So recurrent. What about the recurrence?
What about the recurrence?
What about the panic attack itself? Memang dua-dua pun boleh jadi recurrent juga. Panic disorder boleh jadi recurrent, panic attack pun boleh recurrent juga.
Was unexpected.
Okay, so the attack is unexpected, meaning patient is not aware of any trigger. Tiba-tiba je datang. Right, so tiba-tiba sahaja datang. And that is followed by what? Fear. Bila benda-benda tiba-tiba terjadi, what happened to you?
Anticipatory anxiety.
Okay, so you're going to have anticipatory anxiety. When will the next attack come? When will I have the second or the third or fourth panic attack? Because it is unexpected. Whereas a patient with borderline personality, during an emotional crisis that they may have panic attack. Those who have OCD, when confronted with the obsession, they may have panic attack. Phobia pun sama juga. They may have panic attack when they are confronted with that subject or object. It is expected. And it has a duration lah for panic disorder ni. Right. So that is panic disorder. So dah habis dua dah. Now let's move to any question about panic? Nanti last kali kita akan go through the algorithm. What to screen first, what next, what third. Yeah. Hassan?
Yes, Dr.
Ngantuk Hassan?
Sorry, Dr.
Ngantuk ya?
Bukan. Saya tulis kat bawah ni.
InsyaAllah. So what is the next one? Let's talk about obsession. Okay, obsession is fikiran yang berulang-ulang. Right, fikiran berulang-ulang. In what form obsession ni boleh datang? Adakah ia fikiran saja? Is it just thought? Or you may have something else?
It can become feeling, idea.
So patient may have images, thoughts, urges, impulses, but not feeling. Okay? Urges, thought, images. So there are several criteria for obsession. So what are they? So one is recurrent, images, thought, impulses lagi. Nombor 3 apa? Criteria of obsession. Siapa ada was-was kat sini? Pernah ada was-was? Sama ada mild ataupun mild. Siapa pernah ada? Okay, tak payah mengaku. So apa kriteria ketiga?
It is intrusive thought.
It's intrusive. So what is intrusive in Malay?
Mengganggu.
Intrusive is mengganggu. Lagi tepat, apa lagi perkataan yang lebih tepat intrusive ni? When someone intrudes into your privacy. Apa lagi tepat?
Tidak distrust.
Involuntary itu.
Right. So apa yang dia nak indicate kat situ bila kita kata intrusive thoughts?
Dia tak suka pun, dia tak nak.
Okay. So fikiran yang datang tanpa dipanggil lah. Fikiran yang hadir tanpa you don't voluntarily think about it. It is involuntary. It is difficult to control. It is beyond control lah, beyond your control. Okay. Intrusion. Walaupun dia sukar dikawal, walaupun dipanggil intrusion, tetapi patient know this is part of himself. This is part of himself. This is not from without. This is not from outside. If this is from outside, what is that? Daya Ismail? What is that?
Hallucination.
Right. Okay. So coming from outside, it can be thought incision ataupun something yang inserted from outside. So obsession, patient would say that this is part of me. This is my mind. And it is ridiculous. So patient know this is ridiculous. It is recurrent, intrusive, distressing, and it is unreasonable. Patient aware this is unreasonable. Kalau patient has insight lah. Okay. And usually it is followed by compulsion. But it is not necessary. So in OCD you can either have obsession sahaja ataupun obsession plus compulsion ataupun no obsession at all, just compulsion. So you have O plus / minus C ataupun C plus minus O. Okay, to make a diagnosis of compulsion, OCD. So what is compulsion? Najiha?
It's an act of repetitive behavior to quell the obsession.
Okay, it can be a behavior, a physical behavior ataupun mental procedure which is directed towards cancelling the obsession lah. Okay, boleh tak bagi contoh, because obsession and compulsion ni can be quite complicated. Can you give an example of obsession, an example of compulsion?
Obsession, for example, like hygiene. So the patient may wear glove, brought hand sanitizer everywhere and wash hand. But in this COVID situation, yes, but it is it took longer. The time is time consuming.
Okay, Najiha. Great, you give an example about COVID and hand hygiene kan. So how to differentiate this is a normal hand hygiene punya practice and this is OCD? Talk about obsession first.
So obsession, the patient will have like excessive urge to stay clean. And then they may wash hands. How to?
So we talk about tadi. Sorry, Najiha. We talk about thought intrusion kan, recurrent thought, intrusive in nature. So start daripada situ. So fikiran dia apa? Apa fikiran dia?
Kotor.
Tangan kau kotor. Ataupun baju scrub kau kotor, right? Baju scrub kau kotor. And because of kotor, you need to
clean it.
You need to clean it. You have to basuh kan. So that comes quite a number of times, banyak kali datang, dan you have to basuh. Tetapi usually they have doubt Bila dah basuh, dia rasa macam tak bersih. Kena basuh lagi, kena basuh lagi, kena basuh lagi. So the intrusion thoughts about the cleanliness of that clothes is obsession, and the washing part may be the compulsion. And usually it is time consuming. Kan, 1 hour, it is excessive lah. So macam you mungkin basuh scrub baju sekali sudah cukup, tapi this maybe kena basuh 2-3 kali, tak okay juga, right? So that is an example of OCD. Can you give, can the rest give another example? Salma, another example of OCD.
About okay, religious meaning praying. So obsession is they will have thoughts that they didn't pray and they have to do it again, and so they start praying again and again. So that's the compulsion. So they do it repetitively.
Can you just pick up one part of prayer?
Sorry?
Just pick up one part of prayer and give example. Which part of prayer that you mean?
Which part of prayer?
Yeah. I mean, which part of salah? You want to give an example? I mean, during takbiratul ihram.
Takbiratul ihram or sujud multiple times. They forgot that because we have 2 times we have to do it, so they may think that they didn't do it, so they do it multiple times, or they salam and we have the sujud the sujud that when you forget, so they keep doing it again and again.
Right.
Yeah.
Okay, thank you. Any question about OCD?
Doctor, I would like to ask, I don't understand, just now mentioned you can have obsession without compulsion, and you can also have compulsion without obsession. So tak faham macam mana you can have compulsion without obsession.
You open up your DSM, look at criteria 2, compulsion. I think dekat A, dekat bawah tu dia tulis or according to ritual that must be applied rigidly. According to rules that may be applied rigidly. So patient has to follow certain rituals which is not followed by obsession. So what you're going to see is just a manifestation of repetitive movement, repetitive behavior, but you cannot get any obsession out of it. Simply like that. Okay? Perbuatan berulang-ulang disebabkan patient has to do it for some reason that we do not know. So that it can be compulsion. And it's time consuming. Any other question?
Doctor, I have a question. What's the difference between having a OCD personality and the disorder, the OCD disorder?
Okay, right. So one is OCPD, another one is OCD. So OCPD is a personality, cluster C personality, along with dependent personality, avoidant personality, and we have OCD personality. Whereas OCD is an anxiety disorder. So how to differentiate? They are totally 2 different diagnoses. The presentation can be similar, can be different. They may have, patient may have a little bit of both OCD and OCPD. In OCPD, it is something which is which the patient has since teenage, and it's usually pervasive. Pervasive tu maksudnya it is persistent, day and night, and it is part of patient's lifestyle. Personality is patient's lifestyle, patient's way of seeing things, way of doing things. You know, whenever I want to wash my clothes, I have to make sure it is clean. There are certain steps to it. I have to make sure my clothes are arranged in certain arrangement, certain color coding, and I don't trust anyone else. It needs to be done in certain laundry shop only, right? With certain soap and etc. So there is an element of perfectionism there, element of rigidity, okay? And it happens to all domains of life. The way how she interacts with friends, the way how she does her job, or the way how she does her assignment, etc. It is characterized by perfectionism and other traits. Whereas OCD, you're gonna find this, it is just wax and wane. Usually develop, sometimes it can develop during adolescence, but some people develop later on. It's usually fluctuating up and down. It is not pervasive, not persistent. It is usually localized to certain part of patient's life. Contohnya, it's about hygiene only. It's about prayer only. It's about hygiene. It's about safety only. So that's some of the differences between OCD and OCPD. Okay. And they don't have intrusion. They don't have thought intrusion in OCPD. Let's move to generalized anxiety. So in generalized anxiety, the key features is worry. Worry. So what about the worry that you want to tell me about GAD? What's about this worry that makes someone has GAD? Nabiha.
It is excessive worry.
Okay, so it's excessive worry. Lagi? Sebab if you say it's excessive worry, then dalam phobia, diorang pun ada worry juga. They have excessive fear and worry about high place contohnya.
It is difficult to control.
Okay, it's difficult to control. So obsession pun susah nak control juga. What makes it GAD?
There is no specific thing in GAD for the worry.
Okay, so patients tend to worry about a lot of things. What we call as free floating anxiety. Free floating. The anxiety is free floating. So dia boleh risau tentang banyak perkara dalam hidup dia. Contoh, cuba bagi contoh.
Financial, occupational.
Lagi?
Work, relationship.
It can be anything in patient's life. It can be social, financial, study, relationship. And it is followed by other physical symptoms like restless, headache, muscle tense, on the edge, and it has to fulfill certain duration. Right. So that's about anxiety disorder in general. Any question?
Doctor, will the anxiety persist throughout the time ke they have certain times that they do not have the anxiety?
Tak dengar Faris, kuat sikit.
Does the anxiety present continuously or they have specific time?
Okay. So anxiety disorder, we talk about cause of anxiety disorder. Kalau macam OCD, it's usually starts during adolescence. Usually, commonly started during adolescence, and it lasted lifelong. But the cause is fluctuating up and down, up and down. It is not present all the time, depending on severity juga lah. Sometimes when the patient is too tired, lack of sleep, stressful condition, so dia punya OCD to become worsen. And sometimes when the patient is okay, then it is still manageable. Okay. So that is OCD. GAD pun sama juga. GAD, phobia semua ni, it is up and down juga. So GAD, as compared to panic, OCD and etc., it is more persistent. More persistent. If you were to have GAD, it occurs on daily basis, whereas panic disorder ataupun panic attack, it comes and go. OCD pun macam tu, as I said, it is episodic. Okay, so when you clap, you want to know this anxiety is episodic or it is more persistent. So that is one algorithm to see the cause tu sama ada dia episodic ataupun persistent. So that's one way to see whether this is this or that. Okay, any question?
Doctor, can I ask about the compulsion just now? Tadi compulsion it could be physical like behavior or mental acts. Contoh macam mental acts tu macam mana doktor?
Mental compulsion means patient has to do certain mental ritual ataupun mental maneuver to stop the obsession. Contohnya, I have a blasphemous thought about God. Whenever I read Quran, when I say Bismillahirrahmanirrahim, when it comes to word Allah, I can see Dajjal in my mind. Okay, to me, I already become a kafir because I read Allah and then I see Dajjal. So I tend to associate, if I have OCD, I associate Dajjal with God, right? So I think I have become a disbeliever. So that is my obsessive thoughts. I become worried, I rasa I dah jadi kafir, and because of that I'm anxious. The compulsion is, perhaps I have to say certain words silently in my mind so that I become a Muslim back. Contohnya, I mengucap ke, right? I have to count ke, I have to say certain prayer in my head ke that no one know, right? So that is mental compulsion lah.
Okay, doctor, thank you.
Welcome.
Doctor, I want to ask question. Okay, so just now doctor said that the GAD is more varied in terms of the dia punya anxious. But then if the patient been excessive worry towards insomnia per se, so can we call that GAD also?
Worry about insomnia, when I say free floating anxiety tu, dia risau tentang banyak perkara dan tentang banyak perkara. Kalau insomnia itu hanyalah satu sahaja, then it is not a GAD lah. What about the insomnia that the patient worried of? What about the insomnia?
The insomnia, for example, patient just withdraw from the smoking that leads him to insomnia. So the patient was excessively worried why the patient had the insomnia. So can we diagnose the patient as GAD?
How about other worries? Worries about other things?
If
Other
it's
than
just
worry
about insomnia?
Sorry?
If the worry is just focusing on the insomnia?
Saya dah cakap tadi, worry tu has to be on many things.
Oh,
okay. Patient is a worrier. Okay.
Okay.
Right.
Okay, thank you, doctor.
Okay. So let's see an algorithm to this. How can I share my slide? Present now. Chrome tab. Oh, no. My screen. Okay. Can you guys see this? Oh, bukan situ, sorry. So, this is one way of, sometimes when you clock a patient may have multiple symptoms. Dia ada anxiety symptoms, Dia ada mood symptoms. Maybe mood symptoms tu depressed ataupun manic ataupun euthymic. So it is important for you to know the background of this anxiety, whether the anxiety itself occurs as a standalone condition ataupun there is something at the background, meaning anxiety here, depression. Maybe patient has developed some other depressive symptoms first and then patient has anxiety. So because of that, kalau yang tu, that if that is the case, we say that depression with anxious distress. Patient is depressed and has other some anxiety features. If the anxiety, the background mood is euthymic, so you can say it is anxiety disorder, right? And anxiety can also occur at the background of hypomania. So it is important for you to know the mood prior to that. What happened prior to the onset of anxiety? And this is another algorithm. Okay, first of all, step 1, please consider, boleh nampak tak? Pecah-pecah tak?
Nampak, Doktor.
Tak pecah
Tak sangat.
Consider the role of general medical condition or substance use and whether the anxiety is better accounted for by another mental condition. So when you clerk, you may not come to medical condition or substance first lah. This is after you have clerked the patient, you want to come up with the diagnosis, then you follow this step. So can this anxiety, can this obsession or panic can be explained by other medical condition? Can hyperthyroidism explain patient's condition? Does patient has other hyperthyroid symptoms which cannot be explained by panic disorder per se? Contohnya dia ada goiter, ada family history, memang ada known history of thyroid disorder contoh. Or patient is taking substance. So can the obsession, can the panic disorder explained by this situation? If yes, it could be anxiety disorder due to other general medical condition. If the answer is no, do the presenting symptoms include one or more panic attacks? So now they are going to apa yang tadilah yang apa Paris tanya tu, sama ada ia persistent ataupun episodic. So they go into whether this is episodic or persistent. So do the patient has symptoms suggestive of panic attack? Right? If yes, ada panic attack, then you want to know whether it is expected or not expected. Whether it is followed by whether a patient has anticipatory anxiety or no anticipatory anxiety. So kalau ada anticipatory anxiety, ada unexpected, then it's a panic disorder. Kalau tidak ada, it is panic attack that can occur within the context of social phobia, OCD, PTSD, and other specific phobias. So far, okay?
Okay, Doktor.
Right. So kalau ini bukan satu panic disorder, bukan panic attack, then do the presenting symptoms include fear, avoidance, or anxious anticipation about one or more specific situation? Okay. So, okay, kat sini dia pergi kepada phobia tadi tu lah, which I already explained here, right? Do the presenting symptoms include fear of separation? Kalau ada fear of separation, the fear is directed about separating, so you can go to the diagnosis of separation anxiety disorder, which we didn't discuss just now. Does it involve worry or anxiety related to recurrent persistent thoughts? So they just follow this thought, this flow chart kan? You want to rule out one by one, right? So this is self-explanatory. I can just share with you later lah. Okay. Right. Any question? Do you guys have any question?
Assalamualaikum, Doktor.
Salam.
Okay, I have one question regarding the GAD. You said GAD is they worry about multiple things, kan? What if kalau patient ni dia just worry about school performance je, but then macam dalam school performance dia macam banyak benda yang dia really like, assignment and then macam exam. Does it consider GAD as well?
Tell me more about the case.
Let's say this patient, sorry?
Go on.
A Chinese boy, university student, and then dia persistent worry about dia punya school performance, in academic performance.
Okay. What's about the worry? Tell me.
Worry about the nak siapkan dia punya assignment, and then at the same time worry about going to exam. But other things dia tak worry lah about the other aspect. Maksudnya just dia punya performance je, academic performance je.
Okay. So in other areas tidak ada?
Other areas, example macam dia punya life or something yang macam tak ada. Just the school, the academic performance only.
Okay, dalam GAD, berapa banyak dia punya duration dia berapa lama?
6 months or more.
6 months kan? So sometimes patient has one particular worry at a time. So at the moment, he is worried of schooling. He's worried about his performance. But prior to that, he was preoccupied about something else. So in GAD, the fear to free floating, so dia boleh risau tentang banyak perkara, but it doesn't necessarily occur at the same time. Okay, so it can still be a GAD. If the patient, let's say prior to this, the family told you that the patient tend to be worried about many things. How about other criteria of GAD? Does the patient fulfill them? If the patient doesn't fit the free-floating anxiety that we discussed after a thorough examination and assessment, then there is something in DSM dalam anxiety tu, specific criteria untuk anxiety disorder which cannot be explained by other disorder that we mentioned. So try to look for in DSM today anxiety disorder which cannot be explained by other OCD ke, panic ke, it is not medical condition, it is not substance, it is not OCD, it is not GAD, what is it? So there is a sub 111 diagnosis. Okay.
Thank you, Doktor.
Okay.
Assalamualaikum, Doktor. Regarding GAD, the patient tu, is there a time for patient to be normal at time yang dia tak ada anxiety?
When the patient has recovered lah kot.
Meaning at the background there still always be anxiety without the stressor tu.
Contoh macam saya nak exam, lepas tu kerisauan saya tentang exam sahaja. Tapi before that, sebelum exam tu saya ada risau pasal mati juga. Right? So, sebelum ni saya start dengan risau tentang mati. benda tu berterusan. Ada masa-masa during the day tu it fluctuates, mungkin towards the evening tu mungkin jadi lebih teruk, pagi quite okay. When my mother is around, contohnya, katalah I ni adolescent, when my mother is around, I'm okay. But then when I'm alone, I tend to think, I think to overthink, and then I become worry. So that is just one worry. And then later when the exam is near, the worry change to worry of failing the exam. So it also fluctuates during the time. It fluctuates in a day. It fluctuates in a long term punya ni pun dia fluctuates juga. Right. So the intensity of the worry tu can ranges from mild, moderate to severe. Okay. They may have no worry bila they have recovered from the condition lah. I mean not recovered, control. The condition is controlled. So what else we want to learn today?
Doctor,
yeah,
I have a question regarding we know that some medical condition or some medication can cause anxiety. So is there any special features between the psychiatric illness causing anxiety and some medical condition causing anxiety? Is there any specific features where when patient complain, we can sort of point this is more to medical condition?
Oh, okay. Okay. Let's talk about OCD. What are the medical conditions that can cause OCD? So you need to know the medical condition that can cause a particular anxiety disorder, where you can diagnose a person with OCD due to other medical condition. So what are the disorders that can cause OCD? Not every patient ada diabetes, lepas tu ada OCD, oh this is OCD because of diabetes. No, there are some condition which is scientifically proven to cause OCD and other anxiety disorder. It is physiologically can be explained, kan? So OCD, what are the diagnoses that can present with OC symptoms? Contohnya encephalitis, post-encephalitis. So there is a history of encephalitis in the past. Recently, after that, patient developed OCD, and the imaging indicate that the basal ganglia is involved. Contohnya stroke, post-stroke OCD. Okay, so you get history about stroke and etc. So that is obvious, kan? Or recently you may have heard about a case yang patient developed panda syndrome. Have you heard panda syndrome? Panda, Google sekarang, panda.
OCD following streptococcal infection.
Ya. So, kena ada history benda tu lah. History of sore throat ataupun any infection recently. And it must be, you may have some other evidence lah, serological ke ataupun investigation to support your diagnosis. How about panic? How about panic? What are the things that can mimic panic? Usually they would get themselves investigated thoroughly by cardiologists, buat angio lah, buat ECG lah, buat stress test lah, all turn out to be negative. Right? So those heart conditions, arrhythmias and whatnot can present like OCD. Itu mimik ya, itu bukan panic disorder because of other general condition. Itu just mimic saja. Just macam kita panggil masquerade saja kan. So other conditions like hypothyroidism ataupun what else? Thyroid storm lagi? Apa lagi?
Heart failure, hypertension, eye, stroke, asthma.
Right. So you need to differentiate kat situ. Medical condition yang mempunyai ciri-ciri sama seolah-olah macam panic. Dan you have to differentiate panic due to another medical condition. Berbeza kan? Heart failure, you have palpitation. Patient may thought that, you may be confused. Ini heart failure ke bukan? Ini heart failure ataupun this is panic. Tapi kalau medical kata this is heart failure, then it is not panic disorder due to another medical condition. So you need to differentiate between the two. So what are the medical condition? What are the medical condition that is documented to have panic disorder? Google now and see. I can only think about hyperthyroid lah, endocrine causes.
Kalau bukan cakap heart disease, respiratory disease like COPD and asthma, and drug misuse.
Right. How about substance? What kind of substance that can cause panic-like symptoms? What kind of substance? Sorry, tak dengar. Guys.
Amphetamine.
Yes, stimulant.
Anticholinergics.
Stimulant.
Cannabis.
Cocaine.
Alcohol.
Withdrawal.
And then cocaine, amphetamine, caffeine. Those condition can mimic panic. Right. So, ada siapa-siapa nak jadi pesakit? Nak habis sekarang ke ataupun nak tunjuk clucking sikit? Terpulang. Tak dengar.
Clucking sikit.
Clucking sikit. Siapa nak jadi patient? Siapa nak jadi orang yang kelak? Siapa nak jadi patient?
Kalau jadi patient simptom macam mana?
Itulah, macam mana nak jadi patient tapi tak tahu. Jadi doktor dah pandai dah kan? Cuba Faris kelak saya. Yang lain dengar, jangan kacau.
Ya, Assalamualaikum Cik. Saya dari Program UAE. Hari ini saya nak memasuk berkaitan sakit yang saya hadapi begitu.
Ya.
Okey Cik, boleh ceritakan kepada saya hari ini Cik datang disebabkan apa?
Saya rasa saya ada darah gemuruh lah, doktor. Saya darah gemuruh, saya cepat risau, saya cepat takut. Saya benda ni jadi baru-baru ni saja bila mak saudara saya meninggal dunia. Benda tu terkejut tau doktor. Dia berlaku secara tiba-tiba saja. Dan saya entah macam mana saya jadi sangat penakut waktu sekarang ni. Ada benda-benda berlaku je saya senang terkejut. Lepas tu saya susah pula nak tidur tu. So, saya rasa saya ada darah gemuruh lah. Orang-orang kampung cakap darah gemuruh.
Darah gemuruh ya. Okay, boleh ceritakan kat saya darah gemuruh tu start bila exactly? Cara tepatnya start bila? Bermula daripada bila?
Oh, okay. Dia can I be a difficult patient yang selalu annoy you tu? No. I lebih kurang sejak raya haji lah doktor. Sejak raya haji lah saya jadi darah gemuruh ni. Doktor kira sendiri. Darah gemuruh sejak raya haji. Waktu tu saya tengah tidur doktor, tengah tidur malam. Lepas tu tiba-tiba saya dapat panggilan telefon daripada pak saudara saya mengatakan makcik saya ni meninggal dalam tidur dia lah. Jadi saya sangat terkejut doktor. Saya rasa waktu tu saya tak boleh nak bernafas. Saya rasa saya pun nak mati waktu tu. Rasa tak boleh bernafas, rasa terketar-ketar, rasa macam nak pingsan. Rasa macam apa yang nak jadi pada saya ni kan. Jadi dalam keadaan yang takut tu saya pergi jugalah kenduri tu. Dan bila saya tengok arwah tu dalam keadaan macam tu, saya jadi sayu, saya jadi susah hati, jadi hiba lah. Dan sejak daripada tu dia mengganggu saya lah doktor. Saya dah tak berani dah nak keluar rumah. Saya kena duduk sorang-sorang. Tak boleh duduk sorang-sorang. Saya nak keluar kena berteman lah doktor. Ini badi ke doktor? Badi mayat?
Okay, so cik lupa tanya nama tadi. Nama cik siapa
Sorry?
Saya lupa tanya nama cik tadi. Boleh saya panggil cik Nabil? Cik Ahmad, okay, Cik Ahmad. So Cik Ahmad berkenaan badi tu tak apa. Saya berminat juga nak tanya lebih lanjut tentang badi mayat tu. Tapi kita cakap pasal simptom darah gemuruh cik ni dahulu. Okay. So berkenaan simptom darah gemuruh ni adakah dia berlaku secara berterusan ke ataupun ada certain condition, ada certain situasi di mana cik mengalami darah gemuruh ni?
Oh, okay. Dia macam mana ya? Selalunya jadi waktu saya berseorangan, saya jadi seorang-seorang dekat rumah. Tapi itulah tak tentu juga. Kadang-kadang waktu saya tengah bawa kereta doktor kan, saya sampai kat traffic light. Saya sampai kat traffic light tu, dia jadi gemuruh semula. Dia jadi darah gemuruh, jadi macam tak tentu pasal, jadi macam nak gila lah kat situ. Macam apa benda yang aku takut pun aku tak tahu. So dia boleh jadi kat traffic light, boleh jadi dekat rumah juga. Dia tak berterusan lah doktor. Dia macam ada masa-masa dia.
Baik. Adakah ada sesuatu perkara yang menyebabkan datangnya simptom darah gemuruh tu? Contohnya macam cik nampak sesuatu baru datang darah gemuruh tu ke? Ataupun cik berfikir tentang cik merisaukan sesuatu ke?
Kurang jelas lah doktor, soalan doktor panjang.
Sorry okay, saya faham doktor. Okay, Cik Ahmad.
Ya.
Saya nak tanya, adakah simptom darah gemuruh tu datang apabila Cik Ahmad memikirkan tentang sesuatu ke? Atau ada spesifik perkara yang Cik Ahmad fikirkan baru simptom tu datang?
Okay. I cut you sekejap jadi Dr. Nabil ya. So bila disebutkan darah gemuruh tu, dia sebut apa lagi simptom tersebut?
Susah tidur.
Susah tidur, dia sebut takut. Dia sebut darah gemuruh. Sekarang ni dah clear ke belum gemuruh ni apa? You dah tahu dia is episodik, tapi dah clear belum gemuruh ni apa?
No, doctor.
No. Oh, sama. You understand. Very good.
Yes.
So gemuruh, you want to be focused. You want to focus. What is gemuruh? You dah tanya dah. You tanya open-ended kan. So patient keep on repeating pasal body lah, pasal terkejut lah, pasal takut lah kan. So do you want to be specific?
Ya, betul.
So you can say something like, saya nak tahu lebih lanjut tentang darah gemuruh tu sendiri. Adakah cik bermaksud darah gemuruh 1, 2, 3, 4? Ada tak rasa macam ni waktu darah gemuruh? You want to focus. Tadi you dah open, sekarang you nak focus. What are you thinking now? Darah gemuruh.
I'm thinking about anxiety symptom.
Anxiety symptom kan? Panic symptoms maybe? Okay. Ask me about panic symptoms.
Panic symptom.
Okay, siapa nak bantu Faris? Mungkin Faris dia terkejut sebab dia kena kelak ad hoc kan? Siapa nak bantu Faris? Macam Hassan tak puas hati tu Hassan. Kau nak kelak aku ke? Oh, Hassan pun tak nak. Okay. Who wants to clap me? Sofia nampak confident?
Saya tak confident tapi boleh try.
Cepat.
Okay cik, waktu yang cik rasa darah gemuruh tu, cik ada tak rasa macam berdebar-debar?
Ada doktor. Saya nak cari perkataan tu lah tadi tak keluar. Berdebar-debar doktor.
Ada rasa macam berpeluh ataupun menggigil ke pada waktu tu?
Peluh tak ada doktor.
Selain tu ada rasa macam ada something sekat dekat tekak ke atau ada rasa?
Saya rasa nak muntah doktor.
Rasa nak muntah?
Rasa nak muntah, rasa nak pengsan. Rasa macam gila lah waktu tu. Rasa macam nak gila.
Rasa macam hilang kawalan diri
Saya takut saya hilang kawalan. Saya takut saya buat benda-benda yang bukan-bukan.
Okay.
Kenapa doktor?
Kenapa?
So, when patient ask this kind of question, kenapa, doktor pernah tak alami? Just say it's a difficult question. It is an important question. Soalan ni penting. Saya akan cuba jawab kemudian selepas saya dapatkan maklumat lebih lanjut. Say it again.
Oh, susah soalan cik ni. Tapi saya akan cuba dapatkan lebih maklumat. Nanti maklumat.
Tapi soalan saya ni tak susah sangat kan?
Tak.
Bukan, soalan ni penting, nanti saya jawab.
Soalan ni penting, nanti saya jawab cik.
Okay. Go on.
Okay. So tadi Encik kata rasa darah gemuruh ni datang secara tiba-tiba. Maksudnya Encik tak tahu dalam situasi macam mana. Ke ada kondisi yang menyebabkan Encik ada rasa datang gemuruh ni?
Dia selalu jadi kat traffic light lah doktor. Jadi kat traffic light. Saya jadi takut nak keluar seorang-seorang lah. Saya jadi takut nak keluar seorang-seorang. Saya akan macam duduk kat rumah kalau boleh. Kalau nak beli makanan pun pakai food grab saja. Ataupun kalau nak beli bahan dapur pun saya suruh isteri saya keluar. So, saya kalau boleh tak nak keluar rumah doktor, saya nak duduk rumah. Tapi kalau terpaksa, saya terpaksa bawa orang lah. Itu pun saya duduk sebelah orang lain yang driving.
Okay.
Kalau jadi itu selalunya waktu dekat traffic light lah doktor. Saya tak tahu apa masalah traffic light ni.
Kini dia tak pernah berlaku waktu Encik seorang-seorang tadi
So far dekat rumah dia hanya takut tapi tak pernah jadi macam dekat traffic light tu.
Okay.
So you have other panic symptoms, Patient gonna say a lot of other things, but you keep focus on your task, that is to complete your panic symptoms, physical and cognitive symptoms. Go on. Sebab you have to fulfill berapa symptoms untuk panic? 4 symptoms.
Yes.
Cepat.
Dah cukup. Kalau dah cukup kita move on ke?
Okay.
Okay.
Adalah cognitive symptoms. Oh, dia dah tanya tadi kan pasal mati.
Sebab dia cakap.
Okay. So what are the criteria to say this is panic disorder atau panic attack?
Encik ada rasa macam takut tak benda tu terjadi lagi?
Ya. Saya tak adalah risau benda tu jadi lagi, tapi benda tu sangat mengganggu lah. Benda tu sangat mengganggu. Saya tak suka keadaan macam tu, dan sebab saya terpaksa bergantung pada isteri saya. Saya nak keluar rumah, saya terpaksa bergantung pada isteri saya. And what is that?
It's a maladaptive behavior.
So maladaptive behavior, which kalau patient tak ada anticipatory anxiety, you look for this maladaptive behavior. So it's either this or that. It's either patient has unexpected panic attack, either patient has anticipatory anxiety or maladaptive behavior. Okay, so either or. So I have to go out with my spouse. I have to depend on her. So that is the features. What else do you need to ask?
I need to rule out like other medical or drug. So
before that, you have to ask about the frequency, how many attacks per day, how many attacks per week, how does it affect my social, how does it affect my spiritual, how does it affect my thinking, my function. So assess that thing.
Encik kata tadi ada darah gemuruh setiap kali pergi lalu dekat traffic light, tapi kalau dalam sehari tu encik boleh kata berapa kali encik ada alami simptom-simptom ni?
Dia bergantung doktor, kadang-kadang ada, kadang-kadang tak ada langsung dalam sehari tu. Tapi kadang-kadang kalau macam sekarang cuti sekolah kan doktor, so dia jarang-jarang lah. Macam sebelum ni waktu anak saya kena pergi sekolah, saya kena ambil dia. Benda tu akan jadi on daily basis. Yeah.
Okay. Jadi sekarang ni macam mana encik rasa perkara ni atau simptom ni affect? Macam mana encik rasa dia kacau hidup encik lah? Macam mana?
Saya rasa tak senang lah. Saya rasa macam saya terpaksa bergantung dengan ramai orang kan untuk buat kerja. Okay.
Kalau dari segi kerja encik, hari-hari encik pergi kerja ke macam mana?
Saya sekarang ni kerja dari rumah. Memang mengajar pun daripada rumah, tak pergi office. Saya tak nak keluar lah doktor.
Okay cik, dari segi spiritual.
Macam mana ya?
Doktor, I'm not sure how to ask about spiritual, like how it affects the...
Ask me the usual way that you ask patient.
Cik, disebabkan apa yang cik alami ni, ada tak mengganggu hubungan cik dengan keluarga ataupun hubungan cik dengan keluarga tu?
Saya jadi cepat marah kalau kat rumah.
Cepat marah?
Jadi cepat marah. Wife saya akan cakap benda kecil-kecil je pun, tapi saya rasa serabut. Saya tak suka budak-budak bising kat rumah, saya tak suka orang buat sepah-sepah. Saya akan cepat marah dekat rumah. Yalah, saya tak tahu, lepas daripada jadi benda ni kan, saya berubah.
Berubah macam mana tu cik?
Berubah personality lah. Maksudnya saya bukan orang yang macam ni doktor. Lepas daripada ni saya jadi macam ni.
Okay. Cik, kalau dari segi hubungan dengan cik, kalau tadi dengan keluarga, kalau hubungan cik dengan Tuhan macam mana? Maksudnya cik adakah cik solat macam biasa ataupun macam mana?
Saya siapa tangkap gambar tu? Saya jadi Saya kurang khusyuk.
Oh, okay, kurang khusyuk.
Tak boleh fokus lah doktor dekat rumah.
Okay.
Saya memikirkan banyak benda. So dia terbawa-bawa dalam solat. Memang saya tak boleh fokus. Masalah sebab tak boleh pergi kerja tu menyebabkan saya tak boleh fokus.
Okay, cik.
Janganlah berhenti kat situ, tanyalah lagi.
Tanya lagi. Saya tak tahu. Sekejap.
Okay, so when you get that kind of stuff, when you want to ask about the effect of illness to social and the effect of illness to spiritual, okay, you did the right thing when you ask, how does this affect you? Bagaimana keadaan cik ni memberi kesan kepada keluarga cik ataupun aktiviti seharian. Okay, so that is social part. And ceritakan, kongsikan dengan saya bagaimana hubungan cik dengan Tuhan terganggu. That's fine to me. Walaupun there is a better way to ask, right? Because before you go to about asking his relationship with God, you want to know some background about his religion and spirituality. Kan? So when patient answer that his relationship with God is affected because he can khusyuk kan. Dia sebutkan tadi tak ada khusyuk, banyak gangguan. So jangan stop dekat situ saja. Tell me more about this. Ceritakan lebih lanjut. Perasaan yang cik ada bila mana cik terpaksa, bila cik tak boleh khusyuk dalam solat. Because we have feeling about certain things, and sometimes we have feeling on top of other feelings. I feel sad because of I feel angry towards Faris, right? But because of that, I also feel guilty. So that is feeling upon feeling, kan? So what is my feeling when this thing happened to me, right? So you want to look whether this patient has despair, or this patient feel guilty, or anything else. So explore further about it. Ask the patient to talk about it. You don't feel anxious listening to this. Do you feel anxious kalau patient cakap pasal Tuhan? Do you feel worried that you may have heard something and you cannot do anything? Some people don't want to talk about sadness. Saya tak nak tanyalah tentang kesedihan. Saya tak nak buat dia menangis. Nanti dia jadi lebih suicidal. Ada ke macam tu? Tak ada. So you allow the patient to talk, but do not force lah, kan? Right. So you want to know tell me how's your relationship with him previously, contohnya. You want to know the baseline, and you know what you want to know now, right? So effect of spirituality to health and effect of health to spirituality. Some patient would say, I think I realize something in my life now that I don't own everything. Bila saya sakit, I don't actually own everything. That I find a greater purpose in life. I find something more powerful than what I thought. Kan? So it can either go to positive side or the negative side. When you find something yang negatif, contohnya dia rasa macam dia tak boleh khusyuk, dia rasa bersalah, ataupun dia rasa Tuhan tinggalkan dia, then you want to explore further. Kenapa dia berfikir macam tu? Macam hari tu dengan grup Diana. Kes polis tu dengan siapa?
Yes, with us.
With you, yeah. So bila dia berdoa dan Tuhan tidak tunaikan permintaan dia rasa Tuhan tinggalkan dia. So daripada situ, indirectly you rasa dia sembahyang, dia berdoa kerana untuk mendapatkan sesuatu, kan? So that is the idea about prayer, the idea about doa and etc. So allow the patient to talk, and then indirectly you deduce what you understand about patient spirituality. Kan? Okay. So bila I cakap pasal worry tadi, I cakap about worry, kan saya semayang, saya tak boleh khusyuk, kan? I think about my problem, kan? That time, you should note somewhere that I want to assess about excessive worry. Worry about other things. Worry about, tak boleh bekerja kat rumah ni. Sometimes patient have panic disorder, but patient also has worry. So you need to ask about worry, you need to ask about phobia, you need to ask about obsession. You have to ask about depression. So depression too, you want to know, is it as a result of panic disorder? Panic disorder, patient cannot function and develop secondary depression. Or patient develop depression first and then develop panic disorder. So which is which? You want to know in terms of timeline though. Which one develop first, which one later? Which one can be explained by the former? Faham ke? Alah, cukuplah kat situ. Right, it's already 2 hours. In second session, I prefer to be on-site teaching. We can discuss other parts. Management. I have given to Faris 2 examples of 2 case write-up. So read again about the case write-up. Try to formulate what are the problems with this patient, predisposing, precipitating, perpetuating factors, active problems that can be managed. So bila kata active problem, you have to come up with bio, psychosocial and spiritual problem. And among this problem, please note what are the problems that can be managed, what are the problems that cannot be managed. Meaning, what are the things that is modifiable and what are the things that not modifiable. Non-modifiable, genetic, the defect that he has when he was a kid. So those are non-modifiable. So identify modifiable problems, active problems, so that we can the management. Okay. Ada soalan apa? Am I making you guys confused? Right. So nak jumpa balik bila hari ni berapa bulan? 9 September. 9 September. So nak jumpa balik bila?
I think we try to find other day next week.
Okay. Just let me know nanti.
Alright.
Okay. So yes. Thank you very much.
Doktor, tanya satu soalan? Boleh tak?
Ya, boleh.
Betul. For example, macam tadi kan situasi yang mana Amalin tanya pasal anxiety tu, maksudnya unspecified anxiety disorder tu kan. I just want to ask about the management. Does the management the same macam untuk all the
mesti korang nak kena penelitian kan?
Itulah doktor, kita orang tak faham sangat.
Management in psychiatry ni, kalau you tengok kan, depression, anxiety, OCD, panic disorder, kan semua pakai ubat yang sama. Kalau ubat lah, right? If you talk about ubat. If you talk about psychotherapy, then it depends on the type of cognitive distortion that the patient has. So no, regardless of what diagnosis, but if it affects patient's condition, so the management is directed towards the symptoms. The symptoms. You know, this is one thing that you have to learn. We have to learn. We do not treat the diagnosis, we treat the patient. If the patient has extreme fear about something, treat that. And it is important for the patient, treat that, not the diagnosis. Okay, the diagnosis changes. Yesterday schizophrenia, now panic disorder. But the patient remains the same. You're talking to the same soul. So treat the same symptom, the same complaint. The patient presents with insomnia. And it affects the patient so much that the patient cannot focus and etc. So treat insomnia. So how you want to do it? Divide your symptoms, divide your problem into bio, psychosocial and spiritual issues. For biological problem, biological symptom, treat with biological treatment. Psychological symptoms, treat with psychological treatment. Biological symptoms like appetite, sleep, apa lagi? Those are the two things you can treat with medication. The mood also, dia macam mood tu dia macam half-half kan, dia macam ada psychological component, dia ada biological component. If you treat depression with antidepressant, the biological symptom will be restored first. Psychological symptoms macam anhedonia, low mood, semua akan come later on with the help of other psychological intervention. So patient datang dengan negative thoughts about future, negative thoughts about self-esteem, that is psychological issues. You treat with psychological intervention. So patient tadi tu yang tak diagnosis you tak certain tu, what are the issues? List down and treat accordingly. Boleh?
Okay, boleh. Okay, thank you doktor.
Sama. Right. So being in psychiatry posting, it is an opportunity for you guys to learn about yourself. Kan? When you listen to your patient's complaint, sometimes you reflect upon yourself. Not to over-personalize. Some of you tend to over-personalize and be like, wait, I don't like psychiatry because this is so, rasa macam tak adil kan? Dunia tak adil lah, orang tak adil, Tuhan tak adil. So you rasa macam, why lah? Life is so bitter. Kan? But sometimes you explore about your own weakness. You know that this is normal, this is abnormal. It is okay to cry sometimes. It is, yeah. And then you also learn about healthy lifestyle, how healthy lifestyle would actually influence ataupun contribute to healthy psychological life, emotions. So, yeah. I just want to say, jangan duduk kat bilik baca buku je lah. So, go out and activate your physics. Activate your body. Pergi exercise.
Doktor, saya ada satu lagi soalan.
Tak habis lagi. Benda?
Tak doktor, tadi okay, next tadi kan doktor jadi patient. So what is the diagnosis for your case tadi? Agoraphobia ke?
Boleh lah, panic dengan agora lah, boleh lah. Bila
Okay.
jadi patient, I tak ada diagnosis. So macam, ya.
Okay.
Tapi boleh lah. Okay. Thank you very
Thank you
much.
doktor.
Okay, bye-bye.
Thank you doktor.
Bye, Assalamualaikum.
Salam doktor.
Thank you doktor.
Thank you doktor.
Thank you doktor.
Was that Nora?
Yeah, that was Nora.
Thank you doktor.
Nora mana? Oh, Nora cakap tadi.
Kita tahu